I'm rewarded by helping people make an informed decision, giving them all the facts that I can. And then I also really try to open myself up to be there to answer any questions that they have. I tell all my patients, I'm like, if you ever have a question, I'm like, just feel free, call in, leave a message with my nurse. I just like being able to help people do something that they can't do for themselves. So when I started back in Martin, that is a town of around 2,000 people. It was one of the few job opportunities that was there. I had this plan in my head, I'm going to be a teacher, and I took this job as a nurse's assistant. And, I just realized I loved helping people. I loved being there when they were vulnerable. I loved being there when they needed help. I did my pre-nursing requisites at Black Hills State in Spearfish. And then I went to SDSU here in Rapid. They have an outreach program with their nursing program. So I got my BSN from there. And then I joined Monument Health actually 10 years ago, like last week was my anniversary. I love working in South Dakota. I grew up on a farm and ranch, and so I know the hard work that goes into what makes a South Dakotan, and I am very proud to serve our community. I can connect with them on bases. Like here, we're going into calving season, and I have people come in and they're like, I need to see my doctor before we start calving season. I'm like, I understand, because I said once you start getting cows, putting babies on the ground, like you're tied. I know just kind of what it means to be from South Dakota. So I'm proud of that. I don't think a lot of people understand is how South Dakota are. We're just so sparsely populated that, healthcare is something that is very important. And I feel like South Dakota healthcare organizations in general have done a really good job making it more accessible for our people. Our clinic numbers plummeted. We were not seeing any patients here hardly at all because, we were telling people stay home. And well, with that came furloughs. A couple of my coworkers were actually furloughed. And I was lucky to not be furloughed, but because I had coworkers that were out, I helped absorb their patients to get them in and take care of them. We're kind of, onto this next phase of the pandemic. We're in, the vaccination stage. And so now I'm helping run the community vaccination clinic on Fridays. I never thought, I'd be running a mass vaccination clinic and being the provider that's on staff for, over 800 vaccines a day. I don't really consider myself a hero because I'm doing my job. So I feel like all of us that have come through this are the heroes, not just healthcare workers. I feel like there's more heroes than just the healthcare team.